Today we're going to be talking about how to perform and execute a proper lunge. First, we're going to talk about the primary muscles of a lunge. These are the rectus femoris, vastus lateralis, vastus medialis. Those three are all quadricep muscles. Lastly, we have the gluteus maximus, which is the biggest glute muscle in the body. Next, we have the secondary muscles and the stabilizer muscles of a lunge. For secondary muscles, we have the adductor magnus, the soleus, and the gluteus minimus. For stabilizer muscles, we have the rector spinae, external obliques, gluteus medius, and the bicep femoris. The stabilizer muscles are what's going to help keep your body nice and aligned and stop you from deviating from side to side and not lose your balance. The lunge is performed in the sagittal plane. This is because the lunge is a forward and backwards movement only. The lunge is the most popular single-leg, knee-dominated exercise. It is useful in all sports, but mainly tennis, sprinting, basketball, and soccer. The lunge is beneficial to everyone since it helps with balance, hip flexion, and glute power. The lunge can be done by almost everyone since it can be done with body weight only or with a load. We will go over two basic loads later in the video. Now we're going to talk about technique. The lunge is pretty simple to perform. First, you have to stand up nice and tall, feet hip width apart. Next, you're going to take a big step forward with your right leg and start to shift your weight forward. Now you're going to lower your right thigh until it is parallel to the floor, and your right shin should be vertical at a 90-degree angle. Your left knee should also create a 90-degree angle between your shin and thigh. Your core should be engaged to keep your upper body straight in line. Now you're going to press into your right heel to drive back up to a standing position. Now we're going to take a look at how to perform a lunge from 4 different angles. As you can tell, when she is in a down position, both her knees are creating a 90-degree angle. You can also tell that her upper body is in line with each other from her head all the way down to her hips. You can also see how she is pushing off of her heel on her right leg to come back to a standing position. The first and easiest way to load a lunge is with a kettlebell. You will hold the kettlebell with both arms close to your chest. As you can see, she is holding the kettlebell with both hands nice and close to her body and still able to perform the lunge perfectly. A second way to load a lunge is holding one dumbbell in each arm parallel to your sides. This is a great way to load a lunge because the weight is distributed on each side and helps you stay in balance. As you can see, she's holding one dumbbell on each arm, and you can tell that she's not having any problem trying to balance the weight on each side. Now we are going to talk about some common mistakes or errors. One of the biggest mistakes made while performing the lunge is having the lead knee protrude past the toe. This can cause some serious patellar tendon problems. Another big mistake done while performing a lunge is leaning too far forward on the down leg. This puts too much stress on the hip flexors. Another mistake done is having the knees track inward or outward. One tip for performing the lunge better is to take a step out first before going down. This will help you stay in line and make sure you're going down and not forward. Another tip is to maintain an erect torso throughout the movement. This will help make sure you're in balance and you're not going to fall forward or side to side. Another tip is to make sure that you're making contact with your heel to the ground first and not your toes. One last tip is you want to make sure that you're always looking forward and straight and never down. Looking down can cause you to lean forward and that can throw your form off or cause you to lose balance.